The peritoneal ligaments, the uterine tube, the round ligament of uterus, the ligament of ovary, uterine vessels near the attachment of uterus, ovarian vessels in infundibulopelvic ligament, the uterovaginal and ovarian nerve flexus, epiporon, periporon, some lymph nodes and lymph vessels, dense connective tissue of parametrium present on the sides of uterus, fibromuscular ligament, round ligament of uterus, transverse cervical ligament, uterosacral ligament. These are the described separately under the heading of support of uterus. Arterial supply. It is chiefly by the two uterine arteries which are marked enlarged during the pregnancy, partly by the ovarian artery. Venous drainage. The vein from the plexus along the lateral border of the uterus. The plexus drains through the uterine, ovarian and vaginal vein into the internal iliac vein. Lymphatic drainage. Lymphatic drainage is by aortic nodes from the fundus and the superficial inguinal nodes from the lateral surface and the external iliac node from the lateral surface and the internal iliac node and the sacral node from the vaginal section. Nerve supply. Uterus is richly supplied by both sympathetic and parasympathetic nerve through the inferior hypogastric and ovarian plexus. Sympathetic nerves from T12 L1 segment spinal cord produce uterine contraction and vasoconstriction. Parasympathetic nerves from S2 to S4 produce uterine inhibition or vasodilation.